Hi everyone, thank you so much for inviting me to talk to you about moral injury in medicine. We're going to cover today what moral injury actually is. It's starting to get quite a lot of traction and be talked about in the press quite a lot, so it's worth clarifying exactly what it is we're talking about. We're going to talk about why it's important to have concepts like this in order for us to be able to share our experiences. So it's a concept that emerged from research with combat veterans. There was a psychiatrist called Jonathan Shea who worked in veteran hospitals for about 20 years, and he watched all these soldiers, these veterans who'd been in combat. He watched them come in with PTSD and he watched them receive all the evidence-based treatments, and he watched them not be as much better as he expected them to be. And he couldn't really for a long time understand exactly what it was he was seeing. But so then he formulated this idea that actually what had happened to them in the doing of their jobs, right? So they went off and did this job, and what had happened to them was that their view of the world, their understanding of the world had been so fundamentally compromised by the things that they'd seen that they kind of couldn't come back from it. So rather than being a sort of a psychological injury that has to do with trauma that can be treated with things like EMDR and other types of treatments, it was much more an idea that this was almost like a wound of their personhood or into their soul, or however you conceptualize it, so that the world no longer appeared to be a safe place to them. And not only was the world not a safe place, but they weren't safe people in it. Okay, so he formulates that it results from being involved in or witnessing events which transgress one's moral code. And for him, he said, I think it's a betrayal of what's right, either by oneself or someone in a legitimate position of power, so a leader, right, in a high stakes situation. So obviously for all of us, that really resonates with this pandemic that we're living through right now. So other researchers are looking at the same thing now. It's now being talked about outside the military, and there are some conceptualizations of it which understand it as either witnessing or perpetrating acts which violate your moral code. So a lot of the things that the soldiers were talking about were things like damage to infrastructure, civilian casualties, recovering dead bodies, various types of things. And certainly in my work, the sorts of things that I thought would be morally injurious to people were not what they said they felt was morally injurious. So that's where the concept comes from. There's quite a lot of work going on at the moment in order to try to define it. And I think it's really important to be really aware that it is not any kind of a diagnosis. It's not a pathology. It's not, you're not going to find it in the DSM-5. It's simply a way of thinking about, talking about our experiences so that we can make space for people to share in a way that doesn't suggest that there's anything in any way wrong with them. Okay, so it's normal human experience, but it would manifest as intrusive re-experiencing, which is when we can't get thoughts out of our head. So it's not the same as a flashback. A flashback is a full sensory kind of event, but intrusive re-experiencing are those thoughts that come unbidden. Avoidance of our emotional state, and perhaps places that remind us of the event or people who remind us of the event. Emotional numbing and social withdrawal. And that's social withdrawal is a result of guilt and shame, because if you feel that everything's gone wrong, it's really hard to carry on participating in life and society when you feel that it's very, very wrong and bad. Okay, so that's why, for example, seeing repeated mistakes made that are out in the public and out in the news that's reported all the time, that's why that makes you want to shut down. That's what that is. Okay, so it happens maybe because of, if you understand it as an emotional processing situation, it happens because when we have unpleasant feelings, it's really, really usual for humans to avoid them. Okay, so we just try not to feel them because they're horrible. There's nothing strange about that. But the problem with that is when we numb out our difficult emotions, we also numb out our good emotions. You can't selectively numb out. We think we can, but we can't. And if you don't allow the difficult feelings to come up, they can't be made sense of and they can't be let go. So you have to let yourself feel something in order to be able to let it go, which isn't very much fun, I admit. Humans really love to make meaning of things. We love stories, we like patterns, we like the world to make sense, and we tell ourselves stories about that all the time. But when bad things happen just because they happen, it's extremely difficult to come to terms with, because it's dreadful and no sense can be made of it. And actually it's very, very hard to just say, oh gosh, well, these things happen. Okay, and it may be that for some people the resonance of what's happening. So if patients or people involved in incidents remind you of people you know, it's really difficult to shake them off, obviously, because it feels very, very close to home. So patients and other things might also remind us of ourselves. It's not just about other people, it's about ourselves. And it's important to think about the fact that as we move through the lifespan, different types of events affect us differently. So good examples are like if you become a parent, so if you maybe get married or enter into a long-term partnership with somebody, or if you have a bereavement yourself, or you go through a divorce or similar kind of family type rupture, all of these things will change the way we're affected by the sorts of things we see. But just pop this up for a minute, look. So these acute stress reactions can be really spectacular, and I think that we forget that sometimes. So they can cause physical disruption to us. We're much more likely to have aches and pains, like wherever your sensitivity is. Like if you often have back pain, that's a real classic one. Headaches are an absolute classic as well for stress reaction, of course, and stomach type problems. Things like not being able to concentrate or make good decisions, finding yourself kind of frozen halfway through doing something, not quite knowing why you're doing it, or, like you, I don't know, put the butter in your work bag and your keys in the fridge, that kind of thing. Might be more emotional, feel really overwhelmed, feel low, lose confidence in yourself, which when you're trying to practice medicine is really, really serious, obviously. And our behavioural things, like we eat more or we eat less or we eat different things, we can't sleep or we sleep too much, we avoid other people. It's very important to think about excessive alcohol use and the use of substances, because this is really prevalent in medicine, I'm afraid. And so I don't think we talk about it enough. So using alcohol or other substances in order to manage mood is a serious thing, and we need to be mindful of it. So it really matters for staff that we have ways of talking about the difficult experiences at work that aren't like end of the line type diagnoses, absolute drama and disaster, right? So when we talk, PTSD is a serious illness. It's absolutely treatable. It's actually not that common really, and it's diagnosed by psychiatrists after symptoms have disrupted life and function for a certain period of time. Okay, so you don't fill in a questionnaire online and know that you've got it. That's not how that works. The post-traumatic type symptoms, right, so those acute stress symptoms that I mentioned are absolutely common and normal, and they usually resolve themselves within a few weeks. Okay, so not to confuse PTSD, which is a psychiatric diagnosis of a proper disorder, with the types of really quite startling symptoms that we can feel after difficult events. If we talk about compassion fatigue, it makes it sound like compassion is something that we run out of, and it isn't. Of course we get fatigued, and of course fatigue affects our ability to feel our feelings and share our feelings with other people, but it's not a tank that then runs empty. I'll talk more about compassion in a bit. Also thinking about burnout, that classic sort of burnt match image that's bandied around. Yes, people get exhausted in their jobs. Burnout has been observed in lots and lots and lots of different professions. It's everything to do with the system, because it's essentially something that comes up when the changes you're trying to make for the people that are there can't be made because other parts of the system don't work well enough. And it's exhausting. I always think burnout's a bit the result of banging your head against a wall, because you're simply trying to do the same thing over and over again and never ever getting the result that you want. And I think it's really worth bearing in mind how important it is to think about systems and how systems make jobs really difficult sometimes. And if you're thinking about patient safety, of course, it's all about systems, isn't it? So not just in the pandemic, but working in healthcare at all, we are all in the same storm, but we're very much not in the same boat. So problems at work, difficulties at work, whether they're personal or systemic or interpersonal, they happen for everyone, but they don't happen in the same way for everyone. So that might be because you have a lot of inherent privilege, which might be to do with your gender or gender expression and the colour of your skin and where you went to school and how much money you have. So these kinds of things mean that you're having a different experience at work. They might also be because of your family history. when we start our jobs, of course, we've brought our whole life history with us, haven't we, up until that point? We might have stuff going on at home that's making it really difficult to be at work at that time, and we still need to keep a wage coming in. We might have really great access to support at work, or we might not. We might be being bullied at work, or we might not. So whether it's in the pandemic or not, I think working in healthcare, it's very much shared storm, very much not the same boat. And just be mindful of which boat you're in. And that goes both ways. So that's about having compassion for people who have a lot more going on, or maybe you don't know what's going on with them. We don't have to share all our stuff with everyone. So just being civil all the time, being kind as you can, as much of the time as you can, just on the assumption that perhaps people might be dealing with things you have no idea about. And also, if things are difficult at home, or if you are having a difficult time at work, just bearing in mind that we only have capacity to deal with so much, and that you might need a bit of extra support if you can get that from anywhere at all. We have a terrible tendency to push ourselves, don't we? Look, here's our little doggy in the fire meme. So it's really an incredible thing about the human nature, or human spirit, whatever, we push ourselves as long as we can, and then hop, we will fall over. So we can be both fine and terrible at the same time. And I think it's extremely important to be aware of that, and to know that you might need to put the brakes on, or take some time, or talk to someone before things get really difficult. So I talk to a lot of students about their experience of pre-hospital care, because I thought when I started out that moral injury would really be evident in pre-hospital care, with all the stabbings and shootings and stuff gruesome by the roadside. And these are the sorts of things that they told me, and I wonder if any of them will resonate with you. So they said it's the subtle things that preoccupy you, like the casualty might be making noises as you're compressing, and all of these things stay with you a while afterwards. So this is a really important thing for us to remember when we're ever training people. Okay, so as we get more senior, we forget what it was like to be junior, and we forget that the first time when you do compressions on a person rather than a mannequin, it's a completely different experience. So things that become absolutely day-to-day and bread and butter to us as we become more senior, they're not bread and butter to everybody else. And we need to make enough space in our conversations with trainees so that they don't feel shy about saying, actually, that I couldn't get that out of my head, really. Another student said to me, there were loads of little children looking out of the windows over the scene, and I don't know why, but that sticks with me. Well, as a parent, I know exactly why that sticks with that student. I would find that horrifying too. I don't want children to see violence in the streets at all. It's about making space for everybody's experience, isn't it? We don't need to judge it. If something has upset someone, it's upset them, and that's that. That's okay. It doesn't cost us anything at all to allow that that's true for them. They talked to me about debrief. So these students were part of a really structured program, and debrief was part of their program. So they would be present. They were allowed to go to the HEMS team debriefs, and they had their own people to talk to as well. They had mentors to talk to. But one student said to me, in order for you to do it, to talk, you have to accept that something stressed you out or affected you. And for me, that was a big step. So a lot of what we're doing at work is saving face, is looking like we can do a thing. And in medicine, that's really a result of your training, because we train you as individuals and then we send you off to work as teams. But we haven't taught you very much about how teams work. And you need to have an air of confidence for your patients, of course you do. But actually, you need to also be able to think that inside of you, you're not maybe that confident all the time. So they wanted to talk about things quickly. It needs to be spoken about on the day, or they like to write things down. It's really important. I'll talk to you more about writing things down. It's a really, really useful tool. What made it worse for the students were the ways in which things happened, the reactions of family and friends. The girlfriend was screaming. And then where there had been violent attack. It's always the ones with the violent connotations, which are the hardest to process afterwards. There's an air about it of, God, someone else has done this and it's up to us to reverse it. Well, of course you can't reverse it, but that's what it feels like, trying to fix something that's broken. Juniors look at seniors in a very particular way and think that they're seniors. aren't as affected by the work because they are senior and because they have seen so many different things. But actually the research doesn't necessarily bear that out, and I'll explain why I think that is. This is just one model of empathy. There are others, I think, but this one's important for you because you can see where it's divided into self and other. So other orientated is what you're doing in work all the time. You're going towards the problem, right? But the self-orientated is the part of you that says, oh gosh, that's horrible, and you want to take yourself away from it. So in order to practice medicine, you kind of have to override that part over and over again, which means that you're using quite a lot of cognitive kind of bandwidth in order to keep attending to the person in question. So there isn't much longitudinal research at all. In fact, I don't think there's really any sort of controlled longitudinal research into the effects on people in working in healthcare for a long time. Okay, so we don't have classic, measuring the same people over and over again. But it looks as if you measure, so people who haven't been doing it for very long, people who have been doing it for a long time, and you look at their ability of their brains to downregulate the costs of empathy. So this is done with EEG. So it doesn't look like practicing medicine for a long time gives any kind of an advantage. You don't become numb to it. You don't get used to it as such. So these researchers were saying, I wonder if this is what's causing compassion fatigue in people, that we never kind of get used to the things that we see. There's an interesting debate going on at the moment about empathy versus compassion. So when you empathize with somebody, the part of your brain that feels pain jumps just in the same way it would for them. So we measure this by putting EEG caps on people and then showing them images of like a pin going into skin or something like that, or by zapping another person with a little laser zapper. So it's just like having a rubber band snapped against your skin. And the part of your brain that registers pain jumps when you observe pain. Okay, so although in medics and healthcare professionals generally, that part can damp down a bit over time. It doesn't damp down sufficiently to give any protection. But when we practice compassion, that is allowing someone else's feelings to be there and overtly, not trying to feel their feelings or be with them, but to know that what they're going through is hard, that triggers much better centers in our brain, and it's much more rewarding for us. So what we think might mitigate moral injury is probably talking. It's really useful for humans to be able to share their experiences. Not everybody wants to talk, okay? So there is another way around this because it's not everybody's bag. But creating safe enough spaces to talk where people can come together and share their experience. And peer support is so important because your peers understand your experience because they've had really similar experiences, and you have a shorthand with them that you won't have with other people. There's also less problem with the feeling of contamination. So some of my students and colleagues will say to me, well, I wouldn't tell anybody at home this because they don't need to know. I mean, really young people say to me, well, I'm not going to tell my mum because I don't want my mum to know that this sort of thing happens. So do you remember that student who said, in order for you to talk, you have to accept that something stressed you out? We've got to be really clear that doing this stuff, talking or coming to the wellness session or whatever it might be, requires vulnerability. So we are asking people to put themselves in a place where they're saying, oh, I might need a bit of help with this, and here I am present in this room. Okay, so let's be really mindful that that's what we're asking people to do, and have that right up front. One of the most important things you can do as a senior or as a leader is to model that behavior by turning up to the wellness sessions or whatever they might be, regardless, I suppose, if you can, of the fact that obviously they don't fix everything. So obviously there are systemic issues and there are wellness offerings, and it feels a bit of an odd situation, but you might pick something useful up from them. And certainly more junior staff are less likely to use them if senior staff also don't use them. The other sorts of things that help are mindfulness. You can use all the apps that exist. The reason mindfulness helps, and you don't have to be great at it, and you don't have to keep still. You can do it moving around, walking along. You could do, that's what yoga is, essentially. It gives your mind a little break for a minute. It doesn't have to be for long. It's like releasing the steam from a pressure cooker just a tiny bit. So do just give it a try. It's so easy to dismiss these things because they're not easy. to practice mindfulness isn't easy, and it takes quite a lot of practice, but you can start off in tiny increments. Noticing flow experiences, so noticing your great experiences when you are really good at something, it's going really well. Know that has happened. You probably won't feel it until just afterwards, but then really go, yeah, that went well. I enjoyed it. It doesn't have to be a work thing, but it can be. It can totally be a work thing, but it might be like you're knitting or being great at running or swimming or gardening or cooking. It doesn't matter what it is. Peer support, talking to people you feel safe with. You have to feel safe enough. You can't just do it like that. Don't do it if it makes you feel bad, but with people that you feel safe enough. Exercise and sleep, I'm afraid, all the boring ones, really, really brilliant for your mental health. Expressive writing, so there's lots of evidence to suggest that expressive writing works, going back, I don't know how many years even. So that's literally pen and paper, write for 20 minutes about something that's upset you. You don't have to read it again. You don't have to think about it again. You can tear it up, you can burn it, you do what you like, but it gets it out of your head and it does improve your mental health. So for those who don't want to talk so much, this is something you might try. Having shared goals at work, when we feel like we're all heading in the same direction at work, it's much easier to feel safer there and happier and less like someone's pulling a nasty trick on you. So trying to have shared goals, doesn't matter how small the team is, but feeling like you're heading in the same direction. Imposing appropriate boundaries, that's also work. These are all work, I'm afraid. Being able to say no when necessary, or if it's not no, but being able to ask for time to think about something. Being able to manage your interaction with social media and being able to manage your interaction with your colleagues when you're on your downtime. So if there's a WhatsApp group that you need to mute when you're off, it's okay for you to mute it. And not only do you have to allow yourself to mute it, say, but you also have to allow yourself to not feel guilty about muting it and not feel that you need to explain yourself to other people. There's lots to read about boundaries, and I would really advise that you do that. So we talk about processing. I think you'll have heard people talk about processing. So processing our difficult experiences is that business of getting them out into the open and feeling them and talking about them enough to be able to put them down somewhere so that they're kind of quiet and they don't bother us anymore. It doesn't mean that they go away. It just means they don't get in the way of our life. But it takes time. So there's a lot of talk we're not post-pandemic, but there's a lot of talk just now about being post-pandemic and recovery and we've got to do this and we've got to do that, and it's all very rushed. But it's going to take a really long time actually to even know what we've gone through in this pandemic, and you need to be gentle with yourselves and with others about the amount of time that it takes to even have known what has happened. Because if you've been in kind of constant go mode of actually treating patients and being at work, you've barely had time to even feel it or know what's happened. So that's all absolutely normal. It's not hugely pleasant, but it is absolutely normal. And having a bit of support with that, or someone to talk it over with, can be really, really useful. So what I want you to take away from this is that moral injury, for example, isn't an illness. To be disturbed by the experiences that you have at work isn't an illness. It's just part of being human, being exposed to awful things. Talking through experiences really helps us put them in perspective, and perspective is really everything here, okay? Because stuff can loom really large when it's just in our heads, and if we can have an opportunity to share it with somebody else, we can get it into about the right size, even if it's a terrible thing. So perspective really matters, because it helps us understand we're not alone. If we can share with other people, we realize, oh, I'm not the only person who feels this way. I'm not actually all alone, or there is somebody who can hear my experience and not totally freak out. So sharing our experience is really important. Creating safe enough spaces for people to do that is really important. Having someone in your life that you can talk to about difficult stuff is extremely important for your mental health, and I would really recommend that you do that. Thank you very much.